We will discuss acid reflux, its symptoms, the top 5 causes, how to treat it, foods which are strongly recommended or should be avoided, and effective supplements for gastroesophageal reflux disease. The main idea of acid reflux is that gastric acid frequently flows back into the esophagus, causing irritation. The esophagus isn't adapted to such strong acidity, leading to symptoms like heartburn. Heartburn is a burning sensation in the chest, often behind the breastbone, which can extend to the throat. The second most common sign is regurgitation, which people describe as a sour or bitter-tasting liquid or food coming back up into the throat or mouth. This is the backflow of stomach contents into the esophagus. Acid reflux, also known as gastroesophageal reflux disease, or GERD. Heartburn and regurgitation are well-known symptoms. However, almost 40% of cases involve symptoms that can be vague, leading people not to think about acid reflux. Such symptoms include coughing and a sore throat, especially more prominent at night. This happens because of laryngopharyngeal reflux, where stomach acid irritates the throat and airways. Some people experience asthma-like symptoms, such as wheezing and shortness of breath episodes, which are more common at night and after eating if the person is lying down. Some people also experience hoarseness, more prominent in the morning, and sometimes dental erosion due to acidity. The most common cause of GERD is a weakened lower esophageal sphincter, which normally should close and stop acid flow from the stomach to the esophagus. Its malfunction causes incomplete closure, allowing acid to flow back into the esophagus. The most common cause of a weakened LES is an altered gastric position called a hiatal hernia. In this case, part of the stomach moves up into the chest through the diaphragm, disrupting the normal function of the esophageal sphincter and allowing stomach acid to flow back into the esophagus. The most common causes of this altered gastric position are age, as diaphragm muscles weaken over time, and obesity, where increased intra-abdominal pressure from excess weight pushes the stomach upward. The third most common cause is pregnancy, where hormonal changes and increased abdominal pressure also weaken the esophageal sphincter. Certain foods and drinks, such as chocolate, peppermint, fatty foods, caffeine, and alcohol, can also contribute. Smoking reduces the strength of the esophageal sphincter, and some medications, like antihistamines used for allergies, calcium channel blockers used for hypertension, and sedatives, can have the same effect. Persistent coughing, heavy lifting, and straining during bowel movements can also cause heartburn. If heartburn is not treated and lasts over years, serious complications can develop in about 5 to 10 years, such as Barrett's esophagus. This is a condition where the normal squamous lining of the esophagus is replaced with columnar epithelium, a type of tissue similar to the intestinal lining. This change occurs in response to chronic acid exposure and damage. Barrett's esophagus significantly increases the risk of developing esophageal adenocarcinoma, a type of esophageal cancer. When we say significantly, we mean a 30 times or more increased risk of esophageal cancer. Other complications can also occur, like erosive esophagitis, which is inflammation and damage of the esophagus, and strictures, which are scars and narrowing of the esophagus, causing difficulty swallowing. These scars are caused by chronic inflammation and tissue damage. Now let's discuss how to diagnose gastroesophageal reflux disease, symptoms, and the effectiveness of empirical treatment for these symptoms. Endoscopy is commonly used to visualize the esophagus and detect inflammation or Barrett's esophagus. The gold standard for diagnosis is 24-hour pH monitoring, performed using a small device to measure the pH levels in the esophagus over a 24-hour period. This device is inserted into the esophagus for 24 hours. Esophageal manometry is also used. It assesses esophageal motility and LES function. Now let's talk about the treatment of gastroesophageal reflux disease. The first-line treatment is proton pump inhibitors, PPIs. The most commonly used ones are omeprazole, lansoprazole, esomeprazole, or pantoprazole. They are usually used once daily for 4 weeks, and if needed, for 8 weeks. Prolonged usage is not recommended because of potential serious side effects. Treatment typically starts with monotherapy. Omeprazole is the most popular because it's cheap and available over the counter. Esomeprazole has a slightly higher bioavailability compared to omeprazole, leading to more consistent acid suppression and is used in more serious cases. Lansoprazole starts action quickly, dissolves easily in the mouth, and is available in formulations that dissolve on the tongue, beneficial for patients who have difficulty swallowing pills. Pantoprazole has fewer medication interactions and is safer if the patient is on multiple drugs. These medications are usually taken before breakfast in the morning, about 1 hour before. If proton pump inhibitors are not effective alone, they are used with H2 receptor antagonists like famotidine or ranitidine, which have a milder effect on reducing acid production. Antacids may also be used, particularly if symptoms are severe or not fully controlled by PPIs alone. Antacids are only for rapid symptomatic relief, not for long-term treatment. Common antacids include calcium carbonate, magnesium hydroxide, milk of magnesia, and aluminum hydroxide, malox. Antacids are used on an as-needed basis for mild, occasional symptoms. Usually, a combination is needed. PPIs are used in the morning before meals and H2 blockers before bedtime. However, we should note that in many countries, H2 blockers are recalled due to safety issues. Regarding lifestyle changes, elevating the head of the bed is important to reduce nighttime reflux by keeping the upper body elevated. Avoid large meals and late eating to reduce pressure in the stomach and decrease pressure on the lower esophageal sphincter, which reduces reflux. Avoid triggering foods such as spicy foods, as they irritate the esophagus and increase stomach acid production. Citrus fruits and juices are high in acidity and irritate the esophagus. Tomatoes and tomato-based products have high acidity. Chocolate, caffeine, and theobromine relax the lower esophageal sphincter and increase acid reflux. Coffee, tea, and cola stimulate acid production due to caffeine. Alcohol relaxes the esophageal sphincter and increases acid production. Fried and fatty foods slow down stomach emptying and increase the chance of reflux. Mint and peppermint relax the sphincter. Garlic and onions irritate the esophagus, and carbonated beverages increase stomach pressure and relax the sphincter. Oatmeal is the best food for acid reflux because it is high in soluble fiber and absorbs stomach acid. Ginger has anti-inflammatory properties. Bananas are also beneficial because they are low in acidity and high in fiber, reducing irritation of the esophagus. Melons are low in acid and neutralize stomach acid. Green vegetables aid digestion. Apples and pears are low in acid. Lean proteins such as chicken, turkey, and fish are beneficial because they are low-fat options and less likely to trigger reflux. Whole grains like brown rice and whole wheat bread are beneficial because they are high in fiber and absorb acid. Sweet potatoes, carrots, and beets are also beneficial. Chamomile and licorice tea help soothe and reduce stomach acid symptoms. Lying on the left side is beneficial because it keeps the stomach contents away from the lower esophageal sphincter. This position helps prevent acid from flowing back up into the esophagus. Eating smaller portions frequently reduces pressure on the lower esophageal sphincter and prevents stomach distension. Chewing gum stimulates saliva production, which helps neutralize stomach acid. Avoid tight clothing because tight belts and waistbands increase abdominal pressure. Elevate the head of the bed around 6 to 8 inches to help gravity keep stomach acid in the stomach. Avoid late eating at least 2 to 3 hours before lying down to reduce nighttime reflux. Omega-3 fatty acids can exacerbate the condition in some people because they are fats, but for some people, they are helpful. The same is true for apple cider vinegar. For some people, it exacerbates symptoms because of acidity, but for others, it improves digestion and helps reduce symptoms before meals. Deglycyrrhizinated licorice, DGL, may help soothe the esophageal lining and promote mucus production to protect the stomach lining.